So who loves isotonics?
Woo!
Oh my God. It's amazing. So
That's
I've been
product.
using isotonics, and then I went to my doctor because I wasn't feeling well, and he said, you really should use these vitamins, isotonics. And I was like, I use isotonics. It was great.
Well, the reason why I'm taking isotonic product is because I had a 17-year NBA career, and from that I have a lot of joint problems. Isotonic product, especially OPC3, has done a tremendous job for me.
Nicotine replacement. This tries to trick the brain. And this is the French paradigm bar called Pignagel. This is OPC3, which is a great antioxidant. At least start the process.
Isotonics, the world's most advanced nutraceutical taken orally. Isotonics refers to the form by which the supplement is delivered into your body. Isotonic means having the same fluid pressure as body fluids. This all-natural delivery method reduces the time it takes for your body to absorb the nutrients. Normally, when you ingest a daily vitamin or nutritional supplement tablet, your body must work up to 4 hours digesting and absorbing the vitamins and nutrients. During this lengthy breakdown process, a percentage of the nutritive value is lost. But because Isotonics products are powders, the fillers, binders, coatings, and lubricants that are common to tablet manufacturing are not necessary. And the inactive natural ingredients and flavoring also make the product taste great. Faster and more efficient absorption into the bloodstream increases the value of taking nutritional supplements. Always follow the directions on the label when taking any nutritional supplement. Isotonics products become isotonic when mixed with the appropriate amount of water. You simply mix the product, stir, and drink. It's that easy. Isotonics.
You have to do is say this stuff works. It's all about the science.
By the Food and Drug Administration. This presentation is not intended to diagnose, prevent, or treat any disease or condition, or to recommend a treatment for any disease or condition. I am not a medical professional and am not giving medical advice. You should always consult with your physician before starting any new supplement, exercise program, or before any dietary changes. If you currently take medications, be sure to consult your physician before starting on any supplements. Quite often, people are confused by where they should start when it comes to supplementation. They walk into health and nutrition stores and find aisles and aisles of vitamins, herbs, minerals, and they have no idea where to begin. Thankfully, our company, Shop.com, has come out with what is known as the Daily Essentials Kit. The Daily Essentials Kit is what most people need to remain as healthy as possible through supplements and covers your basic nutritional supplemental needs. Our Daily Essentials Kit comes in our isotonic solution, providing superior absorption of all of the nutrients in each of our supplements. The first thing in our Daily Essentials Kit is a multivitamin. Most of the time when it comes to a multivitamin, people ask, can't I just eat right? And the answer to that is pretty simply, no. The truth is, even according to the former chair of the RDA are not recommendations for the ideal diet. The term recommended allowance is used to avoid any implication of optimal requirements. Now, if you're sitting there right now wondering what the heck I just said, let me translate for you. According to the former chair of the RDA, the recommended dietary allowance, or recommended daily allowance, is not what is recommended to make you healthy. It's what's recommended to help prevent things like scurvy and rickets. But even if you ate 100% of the RDA of every nutrient, you wouldn't be healthy. Luckily, we have food labels to help us make decisions when we're out shopping. I'm an avid label reader, and many people are becoming more conscious of their labels. But let me ask you, how accurate would you like your labels to be? Most people say I'd want it to be 100% accurate. Unfortunately, that would be very expensive and difficult to do. So the government has guidelines they've set in place. Believe it or not, all food labels must be within a 20% range of accuracy, which is way too many according to most people. Most people are okay with a 1% margin of error or even a 5% margin of error, but allowing labels to be up to 20% off is astounding. Even more astounding is the fact that abcnews.com did a study where they pulled 12 different foods off of the shelf to check if they were off by more than 20%. 3 were over the 20%. Ritz crackers had 36% more sodium than was on the label. Wonder Bread had 70% more total fat than was on their label. And David's sunflower seeds had 23% more saturated fat. But go back to Wonder Bread. 70% off on the label? That's crazy. But at least now we know where the name came from. With that much fat, you have to wonder if it's even bread. In fact, the rules themselves often confuse people. If you look at a label and it says 0 grams of trans fat, that doesn't mean there's 0 grams. It means there's less than half a gram of trans fat per serving. But they could divide that package into as many servings as they want to make it under that half a gram to label it 0 grams. The other problem with that is we don't tend to eat one serving of anything ever. We think whatever package it comes in has got to be the serving. So we sit down and we have 3, 4, or 5 servings thinking we're getting no trans fat when in fact we're getting 1, 2, or 3 grams of trans fat in that package. Now if the label, however, says trans fat free or no trans fat, then there's none. Then there are things that just don't make a lot of sense. Here you'll see blueberry bagels from Target flavored with blueberry bits. I always thought blueberry bits were bits of blueberry. But when you turn over the label and you look at it, the blueberry bits have parentheses to explain what's in them. This is not a good sign. And in them are sugar, corn cereal, modified food starch, partially hydrogenated vegetable oil, artificial flavoring, cellulose gum, salt, blue number 2, red number 40, green number 3, and blue number 1. Yes, I've read that correctly. The only thing missing from the blueberry bits are blueberries. There are none. We have this old-fashioned notion of what a farm is like. These rolling green hills and pastures and cattle out there grazing, and nowadays that's not how commercial farming is typically done. This is a modern-day cattle farm. You can see there's not a lot of green for those cattle to graze on. As a matter of fact, some estimates say that about 2/3 of these cattle are injected with growth hormones that may end up as a byproduct in the meat that we eat. And some people say, well, I don't eat beef, I eat chicken. Here's a modern-day chicken farm. Again, very different than the way we used to farm 20, 30 years ago. Sometimes our food is so different, it's unrecognizable. You look at this and think it's ice cream, sorbet, yogurt, maybe even silly putty. But it's not. This is a chicken nugget. Ew. Now I know what you're thinking, 2 things. That's gross, and I've eaten a lot of chicken nuggets, and they've never looked like that. Well, of course they don't. You see, they take this mixture and they blend it up using all the leftover bits and scraps of chicken. So they take the prime cuts, sell them to the stores, take the leftover carcass and throw it in an almost centrifuge-like system. It spins the chicken, all of the meat kind of splatters off, goes down, and is mixed together. Unfortunately, the E. coli and salmonella count go way up when you process meat in this way. So what they have to do is they have to spray the chicken with ammonia in order to cut down on the bacteria. Now, if you bit into a chicken nugget and it tasted like ammonia, you would not eat a lot of chicken nuggets. So they add artificial chicken flavoring or natural chicken flavoring, which isn't natural nor chicken, to make your chicken nugget taste like a chicken nugget. Now, not all chicken nuggets are made this way. Only if you look at the ingredients label and it says mechanically separated chicken. If they use all white meat, that is not what you see in the picture here. In the picture here, mechanically separated. By the way, if you've ever eaten anything that says mechanically separated pork, i.e. a hot dog, could be a similar process. Now, certain companies came forward and said, you know what? We use all white meat in our chicken nuggets. McDonald's was a big one. They say we don't process our chicken nuggets in this way. And it's true they don't. So let's look at what's in their chicken nuggets. Well, there's no mechanically separated chicken, and if you look at the first ingredient, you will see white boneless chicken. Then water, food starch that's been modified, salt, and then comes the seasoning. And if you look, the first seasoning listed is autolyzed yeast extract. And most people don't know what that is. Let me tell you, autolyzed yeast extract is another name for MSG. As if MSG isn't bad enough as the #1 seasoning, when you go through and you look at the oil that these are cooked and prepared in, it's a mixture of canola oil, corn oil, soybean oil, hydrogenated soybean oil, and then something called TBHQ. What the heck is that? TBHQ is a petroleum derivative that's been used as a stabilizer in perfumes, resins, varnishes, and oil field chemicals. In the meantime, laboratory studies show that it may be linked to stomach tumors. A number of studies have shown that prolonged exposure at high dosages may even be carcinogenic. As if that's not bad enough, they add in there dimethyl polysiloxane. It's a type of silicone that's used in caulks, sealants, and as a filler for breast implants. It was also a key ingredient in Silly Putty. Ew, why the heck is this in my chicken nuggets? Well, it sure does make them last a really long time. Maybe this is why if you lose a French fry in your couch cushion and you find it a couple of months later, it still looks exactly like it did the day you bought it. In the meantime, I think I'm going to think twice before I eat this stuff. Even our vegetables are not the same as they used to be because of things like cold storage, pasteurization, and green harvesting, which is picking things before they're ripe and letting them ripen along the way. Nutrients may degrade. As a matter of fact, in 1950, the vitamin C content in 100 grams of spinach was 150 milligrams. In 1963, the vitamin C content had fallen to 100 milligrams. In 1982, the vitamin C content in that same 100 grams of spinach had gone from 150 milligrams to 63. And by 1994, the vitamin C content in 100 grams of spinach was just 13 milligrams. This was a study done by the Japanese Food Standardization Ingredients List that tested the nutritional contents of our food. And then there is the fact that sometimes our food may look as it's always looked, but is a completely different product than it's ever been. I'll leave this on the screen just for a moment for you to read so you can understand how some genetically modified foods may be different than non-genetically modified foods. So here you could be buying sweet corn that you think is just like everything else, and it's a completely different product than it's ever been in our history. Now, I will tell you that we don't know what effect this is going to have on people as far as health goes. As a matter of fact, even the government has stated that they don't believe there's any health implications, but they won't know for 20 to 40 years. This has got to be in our body and in the system long enough before we know its effects. This is why people need a good, high-quality multivitamin. Our food looks like it has always looked, but is completely different than it has ever been in history. Next, I'd like to talk to you about oxidative stress, also known as rusting. People are well aware of the fact that metal rusts. What I also need you to realize is that living things can go through a sort of rusting process. This oxidation or free radical damage is apparent if you've ever cut an apple in half and left it out on the counter. You can see it begin to turn brown or oxidize due to free radical damage. Well, guess what? People rust as well. And the top causes of oxidative stress in your life are radiation, chemicals, metabolism, pollution, and stress levels. Not only stress as far as having a stressful lifestyle, but things like chemical stressors, UV, caffeine, and sugar as well. Now, you're meant to have some free radical damage, the normal part of the aging process. However, excessive free radical damage without sufficient repair can actually create damage to your proteins, cells, cell membranes, tissues, and even DNA. As a matter of fact, free radical damage and oxidative stress has been linked to over 200 different degenerative states, Some of them are listed on the screen for you right now. So how do you fight off all of this free radical damage or help to keep it in control? You do it with something called antioxidants. And if you watch the news or read health articles, you're going to hear about all the benefits of antioxidants. That's because antioxidants help to slow down that free radical damage, or that rusting. What I'm going to talk to you about now is called OPC3. It is the world's strongest antioxidant in an isotonic solution. It's red wine extract, grapeseed extract, bilberry, citrus bioflavonoids, and an ingredient called pycnogenol that I'd like to take a little more time to discuss. If you go to www.pycnogenol.com, you'll be able to find all the studies that I'm going to reference for you right now. But how can pycnogenol help with overall health? First of all, pycnogenol is a natural antihistamine, so people that have allergies and asthma will often notice beneficial properties of the pycnogenol. But beyond that, pycnogenol may help antioxidants inside the arteries and actually double their effectiveness. Pycnogenol can slow down the age-relating decline of your immune system. So as we get older, we know our immune system begins to fail us, and it turns out pycnogenol may be able to help boost that immune system. Pycnogenol may be protective to the retina of the eye. It also may be able to help to inhibit cell death of neurons. Now, this is something that they look at when they're looking at dementia. Pycnogenol may also be able to provide relief in those people with hyperactivity, particularly with children with ADHD in a double-blind, placebo-controlled study. If you go to medicalnewstoday.com, you're also going to find some other interesting articles. All the major characteristics of metabolic syndrome appear to improve with pycnogenol. Pycnogenol will lower elevated urinary protein levels and may help to improve blood flow to the kidneys. Furthermore, pycnogenol may help with deep vein thrombosis and jet lag symptoms for people that are taking long flights. Another study even showed that pycnogenol may help with blood glucose stabilization in a type 2 diabetic. The other ingredients that are in our OPC3 may have benefits as well. Grapeseed extract may have blood pressure reducing qualities, while ingredients in red wine may help with eyesight. Grapeseed extract may have promising results with dementia, and may help with unhealthy cells in the body. Red wine has well-known anti-aging properties. We're now going to talk about the activated B complex. B vitamins are, in my opinion, the most important classification of vitamins outside of a multivitamin, because B vitamins can help to increase your energy levels, decrease the effects of stress on the body, improve your mood, help with cardiovascular health, and metabolize amino acids, proteins, fats, and carbohydrates. Furthermore, B vitamins support normal cognitive performance. As a matter of fact, some sources state that B vitamins may be a revolutionary new weapon against Alzheimer's disease. The primary reason for this is theorized that brain shrinkage is one of the things that may help to lead or further to early signs or early stages of dementia. Scientists at University of Oxford conducted a trial on 168 people and found that taking high doses of 3 vitamin B supplements every single day helped reduce brain shrinkage by around 50%. Furthermore, some references show that B vitamins may help with headaches or severe migraine, even offering relief to some people. Now, B vitamins are depleted by stress, sugar, some medications, tobacco, caffeine, some laxatives, alcohol, and irradiated foods. So how do you know if you might be B vitamin deficient? According to the doctor's complete guide to vitamins and minerals, a B vitamin deficiency may show up as things like depression, anxiety, confusion, muscle cramping, constipation, diarrhea, bloating no matter what foods you eat, irritability, anger, sores on the inside of the mouth, lower back pain, fatigue, headaches, involuntary muscle spasms, nerve problems, or spotty hair loss. So you can see that a lack of B vitamins has a wide range of implications according to the doctor's complete guide to vitamins and minerals. As a matter of fact, I see a lot of people that have a lot of these different conditions, and I have to wonder if it's just a B vitamin deficiency. Next, I'd like to talk to you about calcium. And when it comes to calcium, many people are aware of its primary benefits, supporting skeletal health, helping to reduce the risk of osteoporosis, a healthy pregnancy, healthy teeth, and cardiovascular health. People may not be aware of the fact that calcium is important for other reasons as well. You see, calcium helps with nerve conduction, healthy body weight, blood clotting, may ease PMS discomfort, and supports normal muscle performance. Now, if I were to ask you what the best source of calcium is, most people would answer, astoundingly, dairy products. We know that dairy products are the #1 way to get calcium. Only one problem. That may not be true. According to research conducted by the Physicians Committee for Responsible Medicine, milk consumption later in life actually contributes to calcium loss. As a matter of fact, research has demonstrated that people in countries with a lower animal calcium intake, less than 500 milligrams a day from animal sources, have less bone fracture rates when compared to countries with the highest intake of animal products. When you look at countries with the highest incidence of osteoporosis, such as the United States, England, and Sweden, they're also the countries that consume the most dairy products. So I'm not telling you not to consume dairy, it just might not be the best form of calcium for us to get. A great food source of calcium are things like mustard greens, broccoli, kale, green beans, pinto beans, kidney beans, cabbage, summer squash, and romaine lettuce. Now, if you are going to supplement with calcium, it's important that you don't take too much at once because you'd be wasting your money if those pills even break down. You see, calcium can only be absorbed up to 500 milligrams in one shot. So you want to make sure that you have divided dosages. If you were to take 2,000 milligrams of calcium at once, your body just can't break down and absorb that much calcium. Also keep in mind that calcium tablets are some of the hardest minerals for our body to absorb, and you want to make sure that you have things like vitamin D, boron, magnesium, and zinc to help with the absorption of calcium. As if having a daily essentials kit wasn't good enough, our company is severely discounting that kit because we want you to have the best shot at your health. Typically, these 4 supplements would be $195.95 for a 90-serving bottle of each supplement. However, if you act now, we are offering this at a substantial discount. We're going to offer it at $139.95 instead, which is over $55 off the cost of this kit. This is a limited time offer. You can take advantage by ordering this today. Now, if you like the kit, and we know we will, what we suggest you do is go on the company's auto ship program. These will come to you every single 90 days, and if you'll go on auto ship, we will lock it in at the $139.95 price. So we'll lock it in at the reduced rate. Thank you very much for joining me today on our Daily Essentials Talk. I look forward to you joining me on future Health Talks.